Okay, so are we? So we're on live now.
We're live.
Okay.
Yes.
Okay, I'll take this. Good morning, everyone. Thank you for coming on to the presentation about Thermobane today. I do apologise. Katie's having some technical issues. She's there in the corner, a little bit grainy, having problems with the audio. So we do apologise, because normally Katie would be doing this and Sarah and I would be jumping in and saying our bit as we move forward. So I do apologise. The webinar this morning, sorry, my name's Martin. I'm one of the two directors of Thermobane here in the USA. With me is Sarah, our other partner and director, who will be helping with this. And Katie's in the corner. If there's any questions on the chat, please let us know. Okay, right, how do I go down this? I need to know how we go down this. I have no idea.
Make it big again.
Hmm?
Well,
we are trying to scroll down on this. I do apologize. No, that's the plus sign. Okay. Hi, Sarah. Sarah, we're having a technical nightmare here. I'm trying to, I can't scroll down on this.
Try to the next, see if it will do that way.
Do you see at the top where it says open
Oh,
with?
it's a
Open with? Oh, I'm sharing screen. I'm going to have to come off of the share. Okay, I'm really sorry about this, everyone. Thermopoint Power, open with Google Slides?
Yes, that should work perfectly.
Okay, I do apologize to everybody. We are now going to go back and present.
I can share my screen if you guys.
That would be great if you could go through, and we can actually hear you better now too. If you could share your screen, because that would allow us to share the videos when we get to that part. You want her to?
Yeah, okay. Do you want to do that, Katie? Do you want to share? Or Sarah, do you want to share? And then we'll talk through.
Okay, you guys, so she's still having technical difficulties. I would say go ahead and finish sharing your screen and just go off of those slides.
Okay.
And then that way, when you get to the videos, you can easily just minimize that screen and maximize the videos.
Okay.
Are you able to see it now?
Not yet.
No.
No, sorry, I'm really sorry about this.
Well, here, can I?
I'm trying to get off of that screen.
I know.
To be able to present it. There we go. Then I'll go on to slideshow. So we'll do that. Then we'll present. Yeah. Share screen. Share screen. Google Slides. This one. Share.
At the very end.
And then we're going to go to slideshow. Okay.
Okay. That's what I was trying to say.
It's at the very end. Okay, so how do I go backwards?
Ta-da! The end.
I hope everybody has a sense of humor. I'm really sorry.
And they should. Technology can be quite a hassle from time to time.
Yeah, better late than never. Again, sorry, I do apologize, everybody. My name is Martin, this is Sarah. We have Katie on as well. So we want to talk about Thermobane, the business that we have brought over from the UK here into the US, relatively new. And we want to talk about how this one little device can really increase the profits at your wellness business. As you know, it can be quite costly. The setup costs, bricks and mortar, power, staff, etc. If you then start to throw in a medical device, if you start to throw in an IPL, a laser, other things, it can become very, very expensive and very, very costly and consuming before you even start to generate some income. So we're just going to show you the device that we have that actually is a very, very good segue in potentially to some of the other bigger devices that are out there and can get you moving and earning money very quickly. As I said, brick and mortar, a business, you're already into hundreds of thousands of dollars before you even see your first client. A very, very risky scenario, particularly with a lot of med spas in particular that are on the high streets these days. And who can relate to that? I know myself, I'm not fortunate to have 100, 200 laying around, and the little money that we did have, Sarah and I put into being able to bring Thermovane over to here, and it was quite a challenge trying to find some money to get a business going. So what we're trying to show you is there's a way that you can use a medical device to a very, very cheap and inexpensive medical device that you can be mobile with, that you can leverage and get moving straight away. So let's introduce Thermovane. We're going to try and toggle between some videos here because these videos don't seem to be streaming. But one of the first things that happened to us when we came over here is we were able to get on to the doctors because the technology that we have is actually quite unique and it's different to everything else that was in the market or is in the market at the moment. So we're going to go off of share and we're going to reshare a video about that. Okay.
So we're just going to stop share for a second.
Stop share. Let's do a video.
Where's the doctors?
Here we go. Right, we need to go back to share.
I know. I'm trying to pause it.
Here we go.
Oh, this is testing me today. Let's see.
I'm glad we have a sense of humor.
Okay.
Share screen.
Okay. Oh. Okay.
Share. There we go. And away we go. Can we do that?
Red veins and broken capillaries on the face can make you uncomfortable and make you self-conscious, especially on your Zoom calls. Well, our next guest is going to show us how to vanish those veins for good, and I'm talking instantly. Sound too good to be true? Well, we're going to check it out. She's the owner of Hollywood Skincare Clinic, face of Jules. Jules, welcome to the show.
Hi, you guys. Thank you so much for having me. Such a pleasure.
Well, this sounds like such a great technology. Most of us have capillaries somewhere on our bodies we don't like. So first of all, is this a new treatment?
So this is actually not a new treatment. It's been around for many years, but it is actually new to the US. So we are currently the only ones in LA that have this device. This is actually what's known as our red vein removal. So this is a non-invasive, state-of-the-art treatment that utilizes RF, which is known as radio frequency energy.
So many great uses for radio frequency. It seems like we come up with a new application every day. Mm-hmm. All right, I get it now. So let's get started. Explain to us what you're doing.
Sure. Okay. So all of the RF energy essentially traveled through this little small but mighty pen, and it has a little bit of a probe at the very tip. So again, this isn't actually injecting his skin. There's no blood. There's no trauma. It's just going to rest on top of the epidermis. So he's all cleansed, all prepped, ready to go here. And basically what we're going to do is kind of turn him slightly. And again, we just apply a slight amount of pressure. And again, Danny, just to warn you, you're going to feel kind of like a pinprick sensation. Again, it does not hurt. It just feels almost like a hair being removed is how a lot of people explain the sensation. So we'll get right on into it. And that is how the magic is happening.
Are the results instant?
So yeah, I actually see this being removed right before my eyes. So it is a immediate thing, which is really exciting. It's fun for me.
And Jules, as we know that blood vessels come in all shapes and sizes, so this is specific to capillaries. Once you get into bigger veins, it's not going to work.
Right. It doesn't work on blue veins, but it works on all, spider veins. We can treat the legs as well. So it doesn't matter the size. It just can't be a blue vein.
All right, Jules, do you have some before and afters for us?
We do. So as you can see, that client was darker skin toned, and we can actually treat all ages, but we just do ask that you have a parental guardian, of course. And there's a select few that it's not really ideal for. So anyone who has epilepsy, anyone who has a nickel allergy, because there's actually 20% nickel in the probe, and anyone who, of course, is pregnant is not, it's not ethical, essentially.
Okay, well,
that's about it. Everyone else, it's
impressive instant results. Now, do you have to come back to maintain the result? Do they come back?
So no, once that vein is sealed with the RF energy, essentially, it is gone for good.
Jules, thank you so much for stopping by and showing this cool new technology.
Absolutely. Thanks for having me.
Thank you. Nice result.
Bye-bye.
For more information, go to our website at the doc.
Okay. Stop explaining. So we're going to go back to our presentation now.
That was great.
Thank you.
We can't see if there are any questions in the chat while we're presenting. So if there are any questions in the chat, Katie, if you want to get those over to us after or read them to us at the end of the presentation. I don't know how you want to do that, but we're happy to answer any questions anyone has.
Absolutely. If we can just talk a little bit about the goal with this webinar, and thanks for being really patient with us. We're going to talk about what Thermavane is in depth, how it differs from other technologies in the marketplace, how it's used, how you can make a business just from Thermavane. And we see this time and time again, people making some very, very good money out of this one small, simple device, and how you can start your own business today. So acknowledging the gap. So if you've never started a business before, some of us have and some of us haven't, it may seem like an incredibly daunting process, and it is. But if you could just make some money with one small device before you start investing in locations, other services, if you have a network, if you have people that you could use this with, it's a really, really good way to actually get moving very, very quickly without a lot of capital outlay. My name's Katie Harris. Sorry, it's not. Katie, we work with Katie. This is, I think, the third one that we've done, and we've been very fortunate to sell a reasonable amount of devices through Katie and her network. So we're very grateful that Katie's invited us back on again today. Those of you that don't know Katie, she's the owner of Nursepreneurs. We've sold a device to her, and we've worked with her, and she's very, very good at what she does. She bought Thermavane for her own wellness center. That's how we connected. She saw it. She was introduced to it. We did a demo, and then we went up and installed. And Katie can tell you her own experiences, but from what I can gather, she, like many other people, have been very, very successful with the device. She can attest to that.
And one thing I do want to say that I love that Katie has shared with us is she really thought outside the box when she brought Thermavane into the wellness center. She didn't just offer it at the wellness center. I know that she's done some pop-ups, and she's been real successful at those as well, which is nice because it's light and it's portable, as you'll see as we go through the presentation.
And as you'll see, as she describes it, which is true, which we use in other parts of the world, it is the gold standard for spider vein and lower limb treatment. It is the best treatment that's out there. So let's explain. We're going to be clunky. We're going to go to our next video with this. This is Sue, who's been with the company in the UK for around about 10 years now, and she's going to tell you how it works and her experiences with the device.
Thermavane is great.
Right, no, that's, thank you. Yeah, and let's put that on share.
How do you do the share?
So go up to this. Let's go up to this. Let's go to StreamYard Studio and let's present share screen. Window.
There you go.
And there it is. Let's do this next one. Thank you again for your patience. We're just going to kick off with this now.
Yeah.
Okay.
Thermavane is groundbreaking technology which helps to treat vascular blemishes and red thread veins.
Thermavane works by gently heating the proteins in the vein wall. The operator will load a tiny probe, put a little bit of pressure on the surface of the skin, blanch the vein.
Then a current is passed to seal the capillary so that it's absorbed by the body and cannot reappear.
The unique part about Thermavane is it targets the pathway.
It's the capillary wall we're treating and not the blood, so it's incredibly safe. The machine itself is very compact. It's very light and easy to use.
We use a computer program that controls all the settings, so it's a simple plug-and-play device. They take just seconds to set up.
When the treatment's done correctly, then you have guaranteed results, and in the majority of cases it's a one-off treatment.
The process for one vein takes just seconds, and the maximum amount of time the procedure will take is 15 minutes.
It feels slightly pinpricky, slightly scratchy, but there's no discomfort to having the treatment at all. The training days are comprehensive. Within the day's training, you will be confident in using the treatment.
Thermavane gives incredible return on investment, results for your clients. This is why it's got such an excellent reputation.
I was really impressed by the way this piece of equipment dealt with the problem that I stopped offering in my practice, which are face veins. And I was so impressed that I bought my first equipment. And I can tell you that Thermavane literally changed the scope of my practice. It was a source of satisfaction for my patients and for me as well.
Stop screen. Okay, thank you for that. We're just going to move forward, but again, these videos as well, we can share with people if people would like to see them after the presentation as we move through. So the Thermavane story, how Sarah got involved. Do you want to explain how you got involved?
Well, sure. I'm happy to share how I got involved. Martin was over in the UK working as a consultant with Thermavane and saw the opportunity to bring Thermavane into the US. They didn't have a permanent presence here. And so he reached out to me and asked if I'd consider getting involved. And so I flew over to the UK, went to a trade show, and saw the instant results at the stand. I saw the wow factor firsthand and really got excited about the product. And so agreed to come on board and bring it over here.
Thank you.
Yeah.
Thank you. So we would say all you need to know about Thermavane. So there's 3 tips you need to know, and 3 things we're going to teach you here. The difference between Thermavane and lasers, how easy, safe, and effective Thermavane is to use, and how you can use Thermavane in your mobile or brick and mortar practice. And that's key, the fact that this device can be mobile. So what is Thermavane? How does it differentiate from lasers? Thermavane is a very, for those of you who are technically minded, it's a very low current. It's 4 megahertz. Your IPL devices will be starting at 18 and above 27. Your lasers are up at 60, and they're great devices. They're great devices for what they do. They can be very expensive. They can be all encompassing, but they are great devices. But they come with a very high current, which means that when you put them near veins, what you're actually doing is you're actually heating the blood in the vein. We have videos and things we can share with you. You're actually heating the blood in the vein, and what happens is that blood just coagulates. It just coagulates, and what it does is it just blocks up the vein, whereas Thermavane is different. It's so low frequency, we can go right up to the eyelid. We can go to some places, or the places on the face where these other devices can't go. And because we treat the vein wall, we stick the vein wall together, not coagulate the blood. It means that you'll evacuate the vessel and you get an instant result. So why is that important? Our device is a lot more cost effective, is what I'll say, and we'll come to that in a moment. But if you're get involved in a brick and mortar location before you've got any other clients, or some clients you may have, you're looking at a 100K device probably, plus you're looking at the brick and mortar device. With our device, because it's only 4 megahertz, it can be used outside of the clinic location. It literally can be put, as you saw in the last video, it can be put into the suitcase that we provide, along with all the other consumables that we provide for you, and you can wheel it over to your patients. Do what Katie did, have some pop-ups, take it to friends' houses and people such as that. You can do it. You can do that. You can do that with this device, which you can't do with an IPL and you can't do with a laser. So just very, very quickly here, again, it's just I'm talking, but some people like to actually see this visibly. So with Thermavane, you have no risk of scarring. The typical results are instant. There are some things that are maybe 2 or 3 treatments, typically lower legs, for instance, and we can talk about that with you. There is no risk of any burns. If you were to put a laser anywhere near the face, for instance, it will burn you, but there is no risk of a burn. The estimated pain level, pain is relative. Guys tend to be a bit less, a bit more reactive to pain than girls, but it's very, very low on an estimated pain level. Pain is relative. If you go into a very sensitive area, it can be slightly painful in a sensitive area, or slightly sensitive. But generally, when people sit down, they'll say to us, it's a 2, it's a 3 out of 10. It's like having a rubber band pinged against you or a very small pinprick. The chance of reoccurrence, if it's done properly and you follow the protocols, and we teach you how to do this, these conditions that we treat will not come back. And the average treatments required, as we say, are 1 on most of the things that we deal with. There are a couple that are more than 1, which we can explain with you.
And I want to go back to the pain. When you say it can be a little bit painful in areas, I think the key here is you do not need to use numbing cream. And that's really what's important when you're looking to treat your patients. Patients want to be as comfortable as possible, but with our device, you don't need to use any numbing cream. So I think that's key when it comes to the difference between IPL and lasers.
It is. Thank you. Thank you. Thermavane is safe and effective. Without the upfront cost of buying lasers, you can compete with people without having the overhead. We will come to costs in a minute. You can get into this game without having to give up your day job straight away, or give up your day job. You can be mobile straight away and earning good money with this device. Safety features on this.
You want me to talk for a little bit? You want me to chat for a little bit? Okay. You can go to the next one. I'm going to take over for just a little bit to give Martin a break here.
Thank you.
So in working with Katie, I've spoken with a lot of nurses, and I know it's, daunting thinking about starting your own business and wanting to make sure that everything you do is really safe and you don't have to worry about hurting anybody, basically. So there is some fear around using devices, but we love Thermavane. One of the things I really love about Thermavane is because it is so low frequency, like you said, radio frequency, only 4 megahertz, you don't run the risk of burning, scarring, or hypopigmentation. And we know you'll see, we're going to show you the display in a minute, but it's very easy to use. You don't even have to worry about settings. So you can feel very safe and secure operating this device, knowing that you can't hurt anybody.
Thank you. So just some demonstrations of what this can do. Like we've said before, the one on the right-hand side, this was a sports star in LA who actually went to the clinic of Julia that you saw earlier. A derm wouldn't touch this. wouldn't go anywhere near it. You can't get an IPL device on that. You cannot get a laser. This is a before and after 15-minute photo of what was on the eyelid before and what was on the eyelid afterwards. Similarly, on the left-hand side, we can treat veins, and we do this all the time on the eyelid. You can go right up to the follicle and you won't lose the follicle. Okay, it doesn't drop out because it's so low frequency, and we treat these things all the time. Do you want to go?
No, go ahead.
Okay. As I said before, Thermavane cannot burn or damage the skin. And Sarah said it's so easy. You don't need numbing cream. You don't need to worry about the results on your patients. This is very, very safe across all types of skin tones. You don't have to worry about the Fitzpatrick scale, because when you press the button, which actually sets it automatically, away you go. So it's very, very safe. You cannot burn people, you cannot damage the skin, and it can be used as a mobile unit anywhere. What can you use Thermavane on? So as we've said before, you've seen spider veins or telangiectasia on the face. Cherry angiomas, the little red dots, which people have, and a lot of people have them. We can get rid of those, no problem at all, okay? Any red vein, melia, skin tags. We also deal with sebaceous hyperplasia, and Sarah might want to touch on that as well. And we also deal with warts. We do have we do have a protocol to be able to deal with warts. If you have patients that come in with warts, this device will sort those warts out for you. Why is that important? If you're looking to get into business straight away and you're looking to use this device, you have a range of things that you can treat. It's not just thread veins, although it's very good. It is a leader in what it does for everything that we have described. So you have the chance, if you see people, it's not just thread veins, they have cherry angiomas, somebody may have warts, somebody may have sebaceous hyperplasia. You can deal with all of those things just from this one little device. Results are instantaneous, as we've said. So we've touched on this a few times. Apart from lower legs, which sometimes they will take 2, sometimes 3, purely simply because of the way the veins are in the legs. And I think warts, you have to go on a program with warts. But most things are instantaneous with this. This is not Photoshop. This is completely straight after the treatment. The redness will go down very, very quickly after you've applied, which is only some aloe vera gel, nothing technical and nothing fancy that's needed for that. The redness goes away and the veins are gone. And if you follow the protocols, those veins don't come back at all. Results to expect, again, we've got that one on the right hand side, but you can see the cherry angiomas. The cherry angiomas will, when you treat them properly, will go a little bit gray, and then they'll just drop off. They'll be gone. Also the same with skin tags as well. You'll find with the skin tag, again, it will just go gray, and what will happen is a skin tag that we can treat, that will just fall off naturally. If you cut it where it's coming through the skin, there is a likelihood that it's going to come back again. With our device, it does not come back. And again, here's another demonstration of veins on the skin, on the cheeks, that are actually quite common. We see them on the cheeks and on the chin quite a lot.
And that was at a recheck. So you can tell on the right-hand side, she's not pink anymore. I mean, obviously her skin calmed down. We always advise that you have your patients come back in 6 weeks just to see if you need to do any touch-ups.
Yeah. And we come back to the point again, Thermavane replaces expensive equipment. Instant results, it's portable. There's very little else out there that's portable. Patients do love it. Patients in other parts of the world, particularly the UK, don't ask for the treatments, they ask for Thermavane. It's got to that point, and that's what we're hopeful here now. They go in and they ask for Thermavane. It's not painful. There is no downtime. Once you treat somebody, there's no need for stockings on the legs. There's no need for people they can go about their day in the main. Don't go to the sauna, for instance. There's a couple of do's and don'ts, but basically there is no downtime. And there are no expensive needles. We do have a needle. It's a one and done, and it's around about $1.25. That's the only thing that you'll need on an ongoing basis is a needle, a wipe, and a little bit of
I think what she's saying here, though, with the needles is we're not going through the epidermis. So we do have a little tiny needle that we use, but we're simply placing it on top of the epidermis.
Thank you. Yeah. And there's a lot more to this. So do you want to know how you can incorporate this machine into a business? So as we said again, Thermovane uses radio frequency, and we coagulate the vein. We don't coagulate the blood in the vein. If you coagulate the blood in the vein like you will with an IPL device and a laser, what will happen is that pathway, that blockage will get broken down over a period of time, and the vein just reestablishes. Those that you've tried veins using those devices, you're probably looking at 5, 6, 7, 8 times, if ever, being successful about getting rid of the veins. Because we have a low current and we treat the vein walls, all we're doing is sticking the vein walls together with a very low current and sealing the vein as you use the device.
Yeah, and I just want to go along I want to add to this. With the lasers that are really high in energy, what you run into is they will obliterate them. So you can damage the tissue around the vein. So
Correct.
That's where that comes into play. When we seal the vein, it collapses and your body just reabsorbs the vein.
So this again, Thermovane's portable. It fits easy into a suitcase, into a carry case. We see this. The carry case that you need is the type of size that would fit in an overhead locker that you use when you go onto a plane. It's that small that you can carry around.
And we're offering one of those today to entrepreneurs. Yeah,
absolutely. So we're going to go to another video. We just want to show you one again of something that was done in the UK recently. So we're just going to stop sharing. And we're going to go on to this video.
We're getting faster at this.
We are getting faster. It's that one, isn't it?
Yep.
So let me just go back to share.
It's you.
I know. I found my vocation in life. There you go. Like that. And we just want to show you very quickly. Okay. That was very brief. We just wanted to show you, again, that was eyelids. As you could see, that was right on the eyelids, and those skin tags were just gone straight away. Okay. As we just touched on before, Thermovane, it's only real disposable, apart from a wipe, apart from a wipe that we recommend to you, which is a very, very simple wipe, nothing major, and some aloe vera gel after the treatment. The only thing that you're going to need is a needle. And they're about $1.50, and when we bring the device to you, we actually give you a pack of 50. So if you can start to calculate how many treatments you could do with 50, we'll come to that in a moment. We get you up and going, and then the replacements are available from us. You just order with us, and we'll get them out to you the following day as quickly as we can. Okay. Another testimony we just want to share with you again. We see this all the time. This is us when we're on trade shows at the UK. We see this sort of thing all the time.
Go ahead.
Okay. I want to get this one up.
Mm-hmm.
Present. There we go. Just want to show this very quickly to you. We see this when we're at trade shows here as well. We get this reaction all the time.
I've always had a small broken vein at the end of my nose. I've had it since I was about 3. As a child, I became quite self-conscious about it quite early on. As I became older and went to secondary school, I became more self-conscious about it.
Oh my God, it's completely gone almost.
You literally can't see it. You always used to be able to see like the little lines, the little shapes of it, and you can't see that anymore.
Oh no, I felt that emotional. Don't stop it.
Try and move along this. There we go. Back again. Google Slides. And we have countless of those, and we have so many of those types of testimonials we see all the time. So we provide brochures as well. We do provide 25 brochures, 50 brochures. It's gone up. So we provide 50 brochures, and you can come back to us for the artwork to be able to keep getting these things reprinted. We don't keep recharging you for this. I'm not going to go through this. Another testimonial here. You can see the veins right up inside the nostrils. That's we see that seasonality with allergies, with hay fever, etc. These you might see people come back the following year and you think it's reappeared. It hasn't. These things happen when people have allergies and they're sneezing quite a bit. There are some provider testimonials. I'll show you this one more, but we're just conscious of time. That's all that we are. We just want to make sure that we. Sorry, I want to go to this one where we can just give you an idea of the testimonials that we receive from people. This again is UK based, but we do have this. We do have this over here in the US as well. We see this all the time with our clients. So I want to present. Getting fast.
Recently started using Thermavane, and I'm really impressed how easy it is to treat, how quickly they recover, and how lasting the results are. Very impressed. I started using Thermavane in 2013, and I've been nothing but impressed with it. Never had a problem, and the clients love it.
We've had it since 2013. We've had absolutely no issues with this machine. It switches on, it goes, it does what it says it does.
We take a photograph before they have the treatment. We do the treatment. It's a 15-minute treatment, and then it's like magic. They look at the photographs and look in the mirror and the veins have gone. And it is that good and that quick. Getting the clients to feel the way they do, it's worth every penny.
It's fantastic. Clients are wowed.
Okay. Thank you. As I say, we have many things, US based as well. We have a lot of these testimonials if people want to see any of them. So we're working with NOLA. What we're trying to help you is we're creating to help build a landing page for you to help set up appointments through a NOLA marketing system. We can talk to you about that more offline about our association with them. What we want to do is once you've purchased the device and we help get you going, we want to give you a bit of marketing support to help get you moving and start getting some visibility around in your local community to help you try and generate some clients with this. And we can explain that more as we move forward for people that are interested today. Another testimonial there, again, red veins, the redness on the right-hand side, and that just goes down after a period of time. The other thing we do as well is we come to you, we receive, there's a two-part training. Sarah will do the first bit of the training with you basically over Zoom, talk to you about the device, what it can do, etc. And then either Sarah, myself, or the pair of us will come to you and actually do some on-site training with you and your staff to get you really familiar with the device. So just to make sure that you're handling it right, we ask for you to bring in a range of models so we can actually treat various things, and we can show you the results with you. And we don't leave. We're there for the day. We don't leave until everybody in your practice is actually confident.
And if you're doing it on your own, I do provide marketing for you to reach out to people to have them come in and be your models. So if you do not have a brick and mortar building, if this is not an add-on for treatments you're already offering, and you are planning on doing it mobily, then I will help you find a location in your area that we can rent for training for that day. And I'll give you the resources you need to kind of recruit models to bring them in to make sure you're really comfortable with doing the treatment before I leave.
Again, another testimonial. These are cherry angiomas, the befores and afters, gone, don't reappear. So we're just going to switch gears now to price. And we talked about lasers, we talked about the cost. We'd like to offer, because of our association with Katie and how we work and how much we value the relationship and her clients, there's a package here that we would normally sell and do sell for $26,000 that we are looking at $18,000 today. The device itself, which normally retails for $22,000, your needles, your brochures, your on-site training, your rolling suitcase. But the other thing we're going to throw in for you is the polarized headlight. Some of you may use a headlight, may use a mag light, etc. The headlight that we use literally is a cross polarization of red or blue, and we think it's the best in the market for what we see, and it enables you to be able to pinpoint the veins that need to be treated.
Slide on it.
There is a slide. I'll come to that in a second, but we're going to throw that in as well as part of the package today.
Mm-hmm.
So the offer is, we are mapping out territories. America's a big country. I've been here a while, and it's a very, very big country. But basically, we were very, very successful in Europe and other parts of the world. We're out here now. We have been selling devices, but there are a lot of territories out there that don't have this device. There are a lot of people in your city, in your town, in your jurisdiction that don't have it. People that might have it, some of these places, Julia's in LA, for instance, we do have 2 or 3 around there. They're big areas. They are big areas with diverse clientele. So there's a lot of opportunity to be the first person in your vicinity to be able to have this device.
And maybe even your state.
And even maybe in your state. There are a few that I don't think we have anybody in Alaska, for instance, amongst others. So I've never been to Alaska. I'd like to go to Alaska. What's it worth? We get asked this all the time. And this is obviously relative to where you are located. Julia in Beverly Hills, for instance, can charge $500-600 for a 15-minute session, and does, and she's doing very, very well. But conversely, in other locations where we've sold this, we are seeing the average price of $350 per session. How much is this worth to your clients, the people that you know not to have those veins, not to have those blemishes that they have? It's $350. That can be $1,400 per worked hour, per day, per week for 4 clients. That's a lot of money. That's a lot of money. Plus you've got the support of us behind you, with you, and you've got the credentials of this device that's been going since 2012. This is not new. This has been Europe's leader for a long, long time. So there is the opportunity, we feel, for you to earn some very, very good money at a very low cost. Coming back to the point, 4 clients a week, for instance, at that price is $1,400. The price of this device is $18,000. You worked on that scenario, you'd have this paid off in a year. If you were doing it a week, if you were doing $1,400 a week, you'd have this paid off in about 12 weeks. You'd have this paid off in about 12 weeks. It's a very, very simple way to get into the market. Because of scarcity, and we are, look at this, we're not looking to saturate the market. We're not looking to saturate the market. We're looking to grow strategically. I don't want to sell a device to somebody that has one next door. Those of you that want to work with us, we'll tell you where the device is located to you before you make your decision. It's a big country. There's still a lot of growth to do. So we want you to apply, and we want to talk. We'll talk to you about your next steps, how you get involved with us. and you can dominate your piece of the area, your piece of the marketplace with this one device. Come back to the same testimonial. Here's our headlight. We love this device. It's not ours. It's done by Cyrus. We have a really good strategic relationship with them, but it just enhances the dermis. It makes the vein pop out in a way that you can't see it with a mag light. Doesn't do it as well, just a normal light, or just even looking at it. It just makes it pop out, and it means you can actually treat the area a lot better.
And actually, they increased their price. This is a third party that we work with.
Yeah.
This is not a Thermavane product, but
Yep.
we have seen such great results with it that we do recommend it.
That's
And
right,
they
please.
just increased this price to $2,695. So we
Right.
need to have Katie
Yeah,
update
update
that. But
Well,
why
that's
it's so
right.
important is because, as you said earlier, you can see 1 millimeter below the surface of the skin,
Yep.
which makes it really makes you very confident that you're getting the vein in its entirety when you're treating it.
Absolutely.
Oh,
That
there's an example.
That
of
just
it.
gives you an idea.
Yep.
Left-hand side is the order review. Right-hand side, you can see how the vein pops out, so you're able to treat the affected area more efficiently. A little bit there on the difference between diffuse light and polarized light.
Mhm.
This is a really good device, and it comes with the package that we're offering today, which again is 18,000, includes the device, the needles, the brochures, on-site training, rolling suitcase, so you could take this anywhere, and the light. If you're in, we would love to hear from you. We've had a lot of success with Katie and her client base, and Katie's team have been very supportive of this product because they have one, they like it, they see the value of this. If you'd like to be able to jumpstart getting into this industry without massive debt, without a massive overhead, then contact us. There's a URL here, and we would love to have a conversation with you. We have packages available for you. We have financing packages where we're able to. We've got a very good and nimble finance company that we use, who are very good. The other thing is, this is credit card money for some people. Put it on, pay it off. There are different ways to do this if you don't want to have the whole outlay. Okay. Why is it worth it? We respect the job that you do. Of course, it's a fantastic job that you do, but you can work overtime in understaffed units for a fraction of the money, or you can make exponentially more. And we see this with nurses. We see this with people within Katie's community. They are making good money using this device and making clients happy. They're the clients that they treat. It's something that you'll get the satisfaction of them with the wow factor immediately. Immediately they come off the bed, the treatment bed, they will be wowed with the results that you give them. Okay, so when we go back to that, that's the price today. There is another video there. I won't show this.
Yeah.
It's a vein, very hard vein.
They saw it already.
Did they?
Yeah, we showed this earlier, so we don't need to show you this video again.
This was like the London Underground, for those that know
the tube map.
The tube map. It was successfully treated. Two choices: you can start to make money with Thermavane today, or keep waiting for another opportunity. So please book a call, speak with us. Reach out to Katie, reach out to the team, their experience with this device, speak with us. We're here for you, and we'd love to work with you. Okay? Thank you.
You want to stop the share and
I
just
do.
jump back on?
I do.
Okay, so now let's get, phew, we did it. Any questions?
No questions at all.
Well, let's just see. Oh, wait.
No
more questions. Were there any questions during the presentation? Any disposables and cost, typical charge for service? Perfect. We covered it. Stephanie, did that give you all your answers?
If it didn't, Stephanie, if you missed this, average price is $350. Average, depending on where you are, and we can talk to you about where you are and what you can expect to get. The only disposables, $1.50 needle is generally all you need, and a tube of aloe vera. and our cost is 18,000 today.
And something that we did not mention is there is not a service contract with this device. So all of your big laser devices and IPLs, they have a service contract you have to find, and you have to sign, and then you have to see them once a year. And this is a self-servicing device, so that you don't have to worry about a service contract either.
Yeah, good question. Thank you, Stephanie.
How is Katie doing?
Katie, you're up. Katie,
great.
You're up with this.
Great question. What
warranty?
kind of?
What is the feedback? Okay.
Yeah. Okay.
So,
go ahead.
So, Stephanie, we give you a 5-year warranty on the device, a no quibble warranty on this device. It's 5 years. The components within this, and I'm going to be honest with you. We've sold devices, and we've sold devices here. People would come to trade shows here a long time ago. They wouldn't stay, which is why the device never took off, as far back as 2012. And those devices are still running.
Yeah,
those devices are still running, and we have testimonials particularly from a lady in Grand Rapids who actually upgraded to the new one. Nothing wrong with the old one, but she just wanted to upgrade. Liz has her original one from 2012, although we do issue a 5-year warranty.
If you've gone too deep, side effect on that?
Well, we can't go too deep. We rest the probe on top of the skin. We don't penetrate the dermis. We don't penetrate the skin. You can't go too deep. You rest it on top. You literally press, and you just blanch. And when you blanch, you press the foot pedal, and it seals the vein. There is no way you can go too deep on this. Do we have anybody in South Florida? We have a few in Florida, but we would like to. We'll let you know. We'll let you know the closest person to you. Any fixture would you need? Any fixture need? Would you still be available?
Oh yes. Are you asking like if there's any are we available to help you? Like in the future for support, if there was anything else that you need?
Yes.
If that's the question, absolutely.
Yeah, we have a permanent presence here in the US now, and we've been here for a few years. Average treatments done per week. Again, it depends on your client base, depends on who you are,
I mean, but that's a great, that's a great question. So we installed one here recently, and I did the follow-up, and she said, on average, they were treating, I think three patients a week as soon as they got the device. But I would have to find out from other people. What?
Again, sorry, I was looking at
the
question. Yeah, sorry.
Yeah, I can find out more information. I can ask some of our people for you, kind of what, if you want to have a one-on-one with me, I would recommend a call, and we can kind of go over that.
And Carlene, if you contact us, we'll let you know the closest person to.
We don't have anyone. We don't have anyone in Miami.
But we'll let you know the closest person to Miami. But we don't have one actually in Miami at the moment. No. So, is there any other questions? There's been some really good questions here, and if you want to communicate with us and ask us more questions about this, we're happy to field any that you've got that come to mind on this.
I think someone wanted some feedback on Katie and how Katie's doing. Katie doesn't have any volume today, so this is why we've been hosting the webinar. Dallas.
No, we don't. We don't have. We actually have one in. We have one in. I think we have one.
Have this pulled up.
Yeah, we have one in. I know we have one. The contact number, there's a contact, you go into the URL that's provided on the presentation. Going back to the Dallas-Fort Worth, I know we have one at College Station. I'm not sure if we have one in Dallas-Fort Worth, but we can let you know how close.
I don't know how many we have off the top of our head. Honestly, I'm happy to just have a conversation with you when I can pull up our map and go over all of our different locations. Yeah. This is my direct contact number, but definitely if you want to schedule a time with me, go through Katie, fill out the tiny URL, the form.
Yeah. Thank you, Katie. And again, Katie, if any of you want, I know Kate, unfortunately, Katie's had some Wi-Fi issues today, bless us. But if you want anybody, I'm sure she'll talk to you about her experiences with the device. All I will say from our perspective is that I think if the device wasn't working for her, she wouldn't be comfortable with having us on for, I think, the third or fourth time now we've done this. But by all means, follow up with Katie. I'm not trying to create work for you and the team, but by all means, follow up with Katie.
Yeah.
So,
and as far as the demand goes, I do want to say, yes, we are known for thread veins. However, where I'm seeing a lot of the use come from is the off-label indications like the sebaceous hyperplasia. That's been so popular. People are using it as an add-on treatment all the time. The cherry angiomas, the melia, because melia is really hard it's difficult to treat. So when you get melia all around the face, especially with our Asian community, that's where we're seeing a lot of people need it. So
okay. Thank you,
Katie's
everyone.
saying thanks, everyone.
Thank you. We appreciate the time. Thank you. Thank you to everyone today. Okay.
Yeah. Sure.